In Western medicine, there's really no diagnostic test for eczema, right? And its clinical features can vary so drastically. It's kind of hard to filter through that, right? And I think a lot of people, when they have dermatological condition, first thing they do is go to their primary. And their primary isn't specifically trained in that, so a lot of times they'll get a topical steroid, a topical antibiotic, that sort of thing, and hope it all goes away. And sometimes it does a lot more harm than good.
All right. Well, thanks for joining us today, Jasmine. Before we get started, could you give us just like a quick, brief overview who you are, just a little bit of your educational background and sort of the work that you focus on?
Yeah, absolutely. So thank you very much for having me. I'm a licensed acupuncturist and TCM practitioner here in Austin, Texas. I started my schooling in New Mexico, and about midway, I transferred over to Texas, where I completed my master's and am about to complete my doctorate. My specialty is in dermatology. I studied very intensely with a very well-known TCM dermatologist by the name of Mazin Al-Khafaji. So that program is very intensive. It's about a year long, but really insightful as to how to treat dermatological conditions using TCM.
That's awesome. Yeah, it's a really sort of world-renowned program with Mazin, and very challenging, and I think really prepares you really well for this field of dermatology. Let's jump right in. I think our system of Chinese medicine has a really important role to play in dermatology because of the often chronic nature of the conditions. And when you look at skin conditions from a Western perspective, typically standard Western pharmaceuticals are looking at symptom management, and more often than not, they're looking at symptom relief, symptom management, as opposed to going for a cure necessarily, especially in the case of stubborn dermatological conditions. So I wanted to hear your take on that and see what we can bring to the table as practitioners of Chinese medicine.
Yeah. So, our Western system is something that most people are very, very familiar with. Where they're not familiar is Chinese medicine and the differences between Western medicine and Chinese medicine. I think the beauty of Chinese medicine is the fact that we're working on a very holistic level. We're looking at the body and all of its signs and symptoms, and that's no different when we're treating dermatology. We're also looking at the underlying factors. We're also looking at other signs and symptoms that the body's expressing, because everything tells us something in the body. So instead of working toward system management, what we're working toward is getting to the root of the problem, reestablishing homeodynamics, and alleviating the symptoms from the bottom up versus trying to tackle it from the top down.
That's really interesting. In terms of addressing the body as a whole system, and then I think perhaps another thing that integrative systems like Chinese medicine bring to the table is our ability to look and differentiate between different types of conditions that would be lumped under an umbrella term in Western medicine. And one of the things that comes to mind is eczema. It's perhaps one of the most common conditions. A lot of patients suffer from eczema and are looking everywhere for relief, really, and are turning to complementary integrative systems of medicine to try to get some relief. And if you look at a condition like eczema, we would break that down and look at really what the rash looks like, how it's expressing for that particular individual. Whereas in Western medicine, it could, and we're talking atopic dermatitis, perhaps, one of the most common manifestations of eczema. And we would look at how that manifests for that particular person, things that might get overlooked in Western medicine, what the rash looks like, the specific coloration, whether there is what we would look at as a damp component in our system of medicine. And I wonder if you could talk a little bit about that, about what we bring to the table in terms of differentiating between patterns that get lumped together in the Western sense.
Yeah, absolutely. So, in Western medicine, there's really no diagnostic test for eczema, right? And its clinical features can vary so drastically. It's kind of hard to filter through that, right? And I think a lot of people, when they have dermatological condition, first thing they do is go to their primary, and their primary isn't specifically trained in that, so a lot of times they'll get a topical steroid, a topical antibiotic, that sort of thing, and hope it all goes away. And sometimes it does a lot more harm than good. From a Western medicine standpoint, we look at atopic eczema as a hyper-inflammatory state, right? A heightened immune response, if you will, that the body's presenting, and you'll see that in conjunction with asthma, allergies, and those types of things. So when we look at it from a Chinese medicine perspective, we are taking into consideration, yes, is there a heightened immune response? But we're also looking at what is triggering that. What is, like, we have to get down to the nitty gritty, as to why the body is manifesting the way it is. And then on top of that, we're looking at the lesions, but we're not thinking, is this eczema, or is this psoriasis, or, what could this be? What we're looking at is we're looking at color, we're looking at texture, we're looking at exudate, are there macules, are there papules, is there itch involved? What areas of the body are being affected? Because all of that kind of gives us information so that we can treat. And Chinese medicine is a very, very customizable medicine. There is no two persons on the planet. And therefore, each prescription that I write out for, let's say, 5 people who have atopic eczema is going to be completely different than the next. And I think that makes it a little bit different, a little unique, but it really separates us in the sense that we're treating at that level.
Yeah, I think you bring up another important point, which is some of the drugs that are, often prescribed, the steroids to bring down the inflammation, or the antibiotics, can do more harm than good, and they're accompanied by a lot of side effects. And so, by approaching things in a more holistic manner, we're able to minimize those side effects, and we bring that kind of individualized attention to the patient, which is often what they need with complicated skin diseases. They can be quite intractable. It looks like you have a really beautiful space, and this is where you practice out of. Is that right? And you're in Austin, right?
Yeah, I'm in South Austin. I have 2 locations, one in South Austin and one in Southwest Austin. Yeah.
That's awesome. And so if there's anyone local that wants to connect with you, do you want to just throw out your easy contact information, name of your website, something like that, so that folks that are local to you can kind of reach out?
Yeah, absolutely. I'm going to give you 2 website addresses. My local website address is tcmdermatologyclinic.com. And you'll find just general information as well as contact information to reach me personally. But if you or other people go to tcmdermatology.org, that's actually a directory of every person that is certified and board certified, internationally board certified, to treat dermatology using TCM herbs. So there's a whole list of practitioners all across the United States, all across the world. I think those are 2 very great resources, especially, if anybody here locally, I'd be happy to treat for any sort of derm condition. But I want to kind of circle back to eczema and talk a little bit more about how it manifests and how we treat, right? Me personally, when I'm treating a dermatology patient, I'm not looking at using a whole lot of acupuncture. I use primarily herbs, and that's because, I think herbs are so great at just balancing things internally, right? Um, and eczema itself, it has different components, and just depending on where the person is in life, right? You have three different clinical presentations. The first one is infantile, and you see that a lot. And the majority of the cases really start at a young age, between 2 and 6 months old, right? And so when we're treating babies, or children under the year of 1, we're treating with a lot of topical washes, herbal washes, and that sort of thing that you can incorporate into the bath. So they're not necessarily being treated internally, but their body is still absorbing what it needs to absorb from the herbs. And then there's a childhood phase, and that typically is between 18 and 24 months, all the way up until puberty. So when we're looking at the childhood phase, that is really affecting the flexures, the wrists, the ankles, that sort of thing. And of course, everybody's going to present differently, right? And then you have the adolescent and adult phase, right? So puberty onward. And depending on which stage they're at, and depending on how their presentation is, we're going to consider all of that when we're treating, right? And there are different types of eczema. I mean, we have nummular eczema, we have punctilic eczema, atopic eczema, so many different types of eczema. But all of those names aside, what we're really looking at is there heat in the body? Is it presenting itself? Is there a damp component? And when I say damp, I'm talking about, is there oozing? Is there exudate? Are there pustules, or that sort of thing? Because then we have herbs specifically for that, and we also have to look at differential diagnosis. Are we looking at eczema? Are we looking at seborrheic dermatitis? Could this be something like scabies? There are a lot of things to really consider. But when we look at the etiology, in infants, it typically is what we call fetal heat, right? Like there's a heat in the body, and it presents itself in a very hot type of presentation. And one good way of really differentiating, eczema from, let's say, a diaper rash, is that eczema typically will spare the bottom area, the diaper area. And also, there's not much pain to it. There isn't a whole lot of, scratching and irritation like there is with a diaper rash, right? So then we also look at their digestive system, right? And this comes across the board, whether it's an infant or an adult. How is their digestive system functioning? Because if their digestive system is weak, that can make a person prone to these damp-like conditions where you're seeing a lot of exudate, weeping, that sort of thing. And then we're looking at, okay, what are the exterior factors or the external factors? Is it aggravated by wind? A lot of times you'll see that, especially on the face, it'll start to get aggravated by wind. So, like I said, there are a lot of etiological and pathological factors that we have to consider, but I think those are really what predominate eczema from a TCM standpoint.
That's super interesting that when we're looking at the different stages, different age groups that eczema can manifest, we also have the ability to look at a whole range of patterns that might arise, say in an infant or in an adolescent, someone after the age of puberty. Like we look at things in terms of, in the classical Chinese system, in terms of the 5 elements. So we associate those with the different stages of development, of course. look at the different things that might be occurring psychologically as well, and really we don't differentiate between those two. So if there's an excess amount of stress or an excess or a really a desire, especially in the teenage phase, to kind of break out and differentiate oneself and really kind of push back against authority, if that's something that's innate in that particular individual. But we look at it sort of in broad strokes as well, as being kind of an attribute of that phase of development. And so I think that allows us to assess, or it gives us clues as to what might be going on. Of course, every individual is going to go through those different developmental stages differently, but I think we have the added benefit of being able to look at those as distinct, and not necessarily from just, for example, in the Western sense, you might look at those stages as having different hormonal components, and in terms of the stages of growth, but we also have the ability to look at what's going on psycho-emotionally, and perhaps even what we would consider as part of their elemental or constitutional makeup, which just gives us another lens, another way to kind of explore what's going on. And I think what was also really useful is just that sort of basic kind of differentiation between a diaper rash and the atopic dermatitis that might occur in different areas, which is really interesting. Let's see.
And I think
go
you
ahead.
touched, sorry, I think you touched on a good point, and the point being that stress is a huge factor, and we see that a lot more in adults, obviously, than we do in children. But a lot of that, you have stress factors that are going to really mess with the digestive system. You have, stress that's going to increase cortisol. It's very inflammatory to the body. So if you're already in a hyper immune state or an inflammatory state and you pile on stress, it's just going to make things worse, right? And again, that always goes back to our our differential diagnosis. So all of that, from environment to internal presentation, external presentation, and also external factors such as stress, I think, and lifestyle are very, very important key components to treating eczema or any dermatological condition.
I agree. It's almost a full topic, and we can touch upon it briefly here. And of course, kind of making this first conversation a little bit more general and kind of zooming in on eczema a little bit. But that idea of stress, I mean, it's such a key component of skin conditions that it might be worth exploring in detail in another conversation as well. Do you often recommend stress management strategies to your patient base, or I mean, certainly you would consider that in the herbal prescription, or even acupuncture if you're using that. But I'm wondering how you address that with your patients.
Yeah, it's a must. I mean, hands down, it's a must. We can only do so much as practitioners, but if we have a patient who's in a cycle of eating highly inflammatory foods, or, really, really high stress environment, whether at work or at home, all of those can be critical components to them either getting better or staying the same. Herbs are wonderful and they can almost work magic by themselves, but there really has to be that component of participation from the patient standpoint also. So with my patients, I also work a little bit with functional medicine. I look for deficiencies. I look for other ways that we can support their lifestyle, and modify as needed, whether that's dietary therapies or stress reducing techniques, and maybe incorporating stuff like Tui Na or Qigong or Tai Chi, just for them to be able to moderate some of those stressors, I think is critical.
Yeah, the chronic inflammation that the body goes through, whether it's as a result of lifestyle choices, which includes food, of course, um, but even just a diet that's leading to more inflammation in the body. You know, we know that that has such a profound influence, not just on the skin, but overall physiology. And it just happens that the skin is sort of an external organ, right? So we see it reflected in the skin, and perhaps we can even explore this from the functional medicine perspective. But I wonder what your thoughts are on the connection between the gut health and the skin.
Well, it's so important. And I think what I'm seeing now, and I didn't mention this earlier, but I'm a licensed esthetician also. So I've been dealing with the skin for years and years and years, even before my TCM training. And I think it's interesting that there's this new wave of skincare that is considering the skin's microbiome, you know. Um, from a functional medicine standpoint, I mean, we are looking at, okay, how is your gut health relating to all of these inflammatory responses of the body? And I think it's a huge component, because if we have any, leaks in the digestive system, particles are going to get through, they're going to create an inflammatory state, and then it's just going to cycle on and on and on. But back to topically, skincare, there are quite a few lines now that are including pre and probiotics in a lot of their products. So I have really great skin lines that I work with myself that have been very helpful in cases of really mild eczema or seborrheic dermatitis of the face, that sort of thing, because it really helps to balance the skin's microbiome, which I think is very, very important. So I think as we progress, through these years, and I think as we progress from a Western medicine standpoint into a more functional medicine standpoint, more and more we're going to understand the relationship between the skin and the digestive system, and from a Chinese medicine standpoint, I mean, the lung controls the skin, metal controls the skin, and metal includes the lung and the large intestine, and so if our body is not excreting enough toxins and there's a toxic buildup in the body, a lot of times that's going to manifest in the skin. And so we consider that also when we're treating any sort of skin condition.
That's very, very interesting, and the fact that you bring up the lung element, and if I were to just paint that picture a little bit for folks that might not be familiar with the Chinese medicine terminology, it's related to uh, the phase of metal, which one could see in nature as being reflected in autumn. There's never a one-to-one correlation in Chinese medicine, but it is that ability or that phase of letting go. And in our body, you can see it as manifested or as reflected in the lungs and the lung health, which of course the lungs being responsible for bringing in nourishment and oxygen to the body, but also a huge component of letting go, right, and releasing um, toxins. And so it is very interesting, especially in light of what's going on internationally today. And we could kind of wrap up with this topic of sort of current news, which is, of course, the COVID-19 coronavirus. Recently, it's come to light, and we were talking about this a little bit earlier. It was first noticed in Europe, perhaps France or Italy, where they first noticed the dermatological symptoms that were associated with COVID-19 patients. And like you mentioned, for us as practitioners of Chinese medicine, we see the connection between the lung health and the skin health, and it's really not surprising to see rashes developing, and then as when we explore the herbs being used as well, again to treat that component of dampness, manifested in the skin as exudate, but of course the dampness in COVID-19 being manifested as the tremendous amount of phlegm and fluids accumulating in the lung. So we see herbs that treat that excess fluid, excess accumulation in the lungs, but also treat it in the skin in terms of our classical formulas. And we see that in China, those formulas have been effective at addressing COVID-19 symptoms. And so, of course, this is all very new, and it's not like we have any definitive conclusions or answers right now, but I'd love to explore just briefly this topic with you and sort of hear your thoughts about it.
Yeah, you know, to me, when I first saw an article, it was so expected on my end, you know, because of such close relationship between the lung and the skin. You know, I thought it was only, you know, it was only a matter of time before we started seeing things. You know, my Western colleagues are probably, you know, scratching their heads, wondering why skin rashes, right? But from a Chinese medicine standpoint, it makes a lot of sense as to how it's manifesting. And I did see a few pictures where the digits were affected, right? The fingers and the toes. And for us, those are acupuncture points. Those are Jing Well points. And a lot of times those points are used to expel a pathogen. So could it be the body's innate, you know, instinct to just try to push that pathogen out, which is why it's manifesting on the digits? So I thought that was really interesting. I think that there's a lot to be determined. You know, we're still in such early stages of just trying to wrap our heads around this virus, but I thought that it was just such an interesting Chinese medicine connection that we were seeing, you know, between COVID and its presentation, you know, because we think about metal, we think about the lung, we think about the large intestine, we think about the skin. And this is all how it's manifesting, right? You know, you've got lung issues, some have digestive issues, some have skin issues. So it's really interesting how well it fits into TCM theory. Yeah.
That's really interesting. You know, I want to be respectful of your time, and we've covered a lot of ground. Like, you've been really efficient at answering all those questions, which is amazing. And we'll have to do it again and explore a different topic in more in depth. It's been a lot of fun talking to you. It's extremely informative. And before we sign off, perhaps we can leave people with just 3 basic things that they could do just to enhance general skin health. We talked about minimizing stress. We talked about some certain dietary choices they can make. And so I'm just curious if you could leave people with just in general, and again, it's hard for us since we're always very specific about certain things being more suitable to certain people, but overall, if you were to leave this conversation with 3 small takeaways, what would those be?
Gosh, stress is a huge factor. I know everybody's kind of on edge. So number 1 is really be mindful of, you know, what elevates your stress. If you're on Facebook and it's just elevating your stress, take a walk, you know, get off Facebook, or, you know, do what you need to do to manage your own emotional health. So that's number 1. Number 2, like you said, diet is huge. You know, what we take in is what our fuel is. And it's really hard for me to say because people are so constitutionally different. But if I could say one thing, it would be to listen to your body. Listen to your body, know what works for you and what doesn't, because what works for one person may not be the best solution for another. So those 2 definitely are my top 2. For my 3rd one, I would say if you're having skin issues, don't be afraid to reach out. Don't be afraid to explore other options. If you keep getting the runaround, or you keep getting, put on steroids, or they don't have answers for you, they being any practitioner, then definitely I would say explore other options.
That's fantastic. Um, Great. Well, thank you so much, Jasmine. This again, it's amazing to talk to you. Really informative, and please come back and talk to us again.
Yeah, thank you so much for having me. It was great. You take care.
Okay, thanks. Bye bye.